Well, alrighty then. This is something new. I'm actually going to introduce what we're talking about and who I'm talking to and why we're talking about it and all those kind of things. So, just playing around with different format. And one of the things that seems to come up in conversations I have with people, possibly because I talk to so many powerlifters, is we end up talking a lot about working through pain, um, long histories with chronic pain, and obviously you, Jack, have like a really long history of chronic pain. You know how to work with your own pain, and you work with a lot of people with injuries and rehab and all those kind of stuff. So we figured it would just be a bit of fun to answer some questions that people asked us on the internet, and we're just going to go back and forth and see what comes of it. So, welcome,
Yeah.
Jack.
What's going on?
Hey, um, like I said before, we won't talk about why we know so much about pain so much, other than that we have a lot of personal experience, both as clinicians and patients. And then as we go through, I'll try and bring a little bit of neuroscience understanding into pain, because I always find that just super, super helpful. Um, So I'll throw it. We'll start with the first question. Actually, we'll start with the second question. It's more interesting. This idea that pain can be a gift. So, the question from Kim was, "What do you think the gift of pain is, and what can pain teach us?"
Oof. You want me to go first?
Yeah, you go first. Give that a go.
Uh,
How can pain be a gift?
First of all, I don't think pain's a gift.
It's hard to call it a gift, isn't it?
Yeah,
Yeah,
it's at least when you've been dealing with pain for so long, it's definitely not it's not a gift. It's a curse for sure.
yeah.
When
I
you're in chronic pain,
100% agree with that one for chronic pain. Like it's hard to call it a gift. There's a
right?
lot of other things that I'd call it, but not a gift.
Yeah. If you got injured and you learn something from that injury and you recover from it, then it can be a gift. You're learning from it,
Mm-hmm.
right? But chronic pain, I guess if I had to say the gift that comes from longer pain, it would be I can look at people and I can tell what's ailing them or what's wrong with them before they even know what's wrong with them,
Mm-hmm.
or before most doctors know what's wrong with them, because I've been dealing with it for so long, and I've been dealing with so many people with injuries for so long. Now, to make it clear, I'm not a physical therapist. I'm not a doctor. I just, for some reason, I'm the guy that everybody keeps coming to, and I keep telling them,
Yeah,
I'm
okay.
not a doctor. I'm not a physical therapist.
That's once
You need
again
to see that
really,
first.
really similar to me. Like in my old town, like I became that guy. Like physical therapists would refer to me when they had patients that they couldn't quite work out why they were still in pain or doing something. They go, "You should go see this weird guy that does all this neurosciencey stuff." And yeah, so I think pain specialists end up being, it's such a niche area. It's really hard to find people that you can trust that have that experience.
Yeah. I think it's kind of like a science and experience all wrapped into one. You have to you have
Yeah,
to really know a lot about the human body, and if you have experience with pain, you can kind of sympathize, and that's kind of part of the gift of it. You can sympathize with people that are in pain, and if you don't,
definitely good for
you know what I
empathy.
mean?
Yeah,
Empathy. I'm sorry. No, yeah,
yeah,
it was that's a better word. And
yeah.
if
I
you,
find,
'cause-
yeah, I find it really, especially like if I do some like other people that have had hip replacements. It's such a very specific type of pain, and it is big, and it's normally because we've had chronic pain, and then you get a replacement, and then there's about 12 months of more pain with it. Um, it's really hard to relate to. I find, well, me personally, I found it really hard to relate to people that hadn't had either that specific pain or some kind of chronic pain. And it really, really made me feel quite isolated. So that's why I go, it's hard to see it as a gift, because pain, just by its nature, is quite isolating, isn't it?
right? Yeah, exactly. Completely agree. because that pain is, oh well, it's just your hip, just rehab it. Well, that pain in your hip just traveled up to your back, and then it put more pressure on your knee on the opposite side because you're compensating, and then so it's like this trickle effect. And then when you're saying to people, I can't do this, I can't do this. Well, it's been a year. Why can't you do it? Well,
Yeah.
it takes time because the pain of the surgery and then the pain of the rehab is a completely different pain.
Yes. Yeah, I think that's the hardest sort of. I think the emotional pain in rehab I found harder than the physical pain to deal with, because all
Right.
of that rehab and recovery is now I'm being asked to do things that I don't really like doing. Like they're not enjoyable. It's not why I lift weights. It's not the movements that give me joy or pleasure. So now I'm doing these things that I don't really like doing to deal with something that I don't really want to have to deal with. And that it's taken me a long way from where I want to be. So I think that kind of pain as well, it's a good teacher for sure, and you can learn lessons from it.
Right.
That's why I say, I have other words than gift, but I'd say pain
Yeah.
is a really good teacher, or can be.
Yes. Teacher, not gift, for sure. Completely agree with you on that.
Have you found over the years, though, with injuries, that you end up becoming an expert on that joint? If you've injured a knee at any point, and then you go
100%.
through the rehab and you do it all, especially if you're a trainer, like because of our
100%.
weird minds, we're like, we want to know everything about a knee now. Yeah.
Yep. I know every damn tendon and ligament in a knee
Yep.
because I hurt my knee about 15 years ago when I thought I blew out my meniscus, but it was just my LCL.
Mm-hmm.
And I was, so I learned every single thing in a knee so I could rehab it. And now, like when somebody comes to me with their knee and like, oh my God, I think I blew up my ACL. I'm like, no, that's not your ACL. This is, and I go on and, I teach them about it. And then when they go to physical therapy and they come back, I'm like, what are they giving you that for? Do this instead. That's, I think that's why we become these people that are really good at what we do.
Yeah.
But on the other hand, again, we did not go to school for 5 years, 6 years, 7 years to become these doctors of physical therapy or doctors. I do not ever say I know as much as a doctor. I know what I know, and that's it.
Yep. Yep. That's
And I continue
so
to
important.
learn.
I know far too many trainers that start getting that belief that they know exactly what a doctor knows. And I go, well, you might know more than a doctor about a particular area, for sure, easily. You can do that. But you're not a doctor. Don't play.
Right.
Don't play there. Just don't play.
Yeah, doctor's never gonna know how to make a person bench press 300 kilos.
Right.
I can make them do.
I can do that. And
I'll kick a doctor's ass in that.
Yeah. I found the same. Like my kind of introduction. So bench pressing, I got really good at because I was constantly trying to rehab my right shoulder. Because as you were saying off air, I grew up playing rugby and rugby union. So this right shoulder took so much impact for so many years, and I only ever tackled on my right hand side. Often with poor technique. It was more about being big and strong than having good tackling technique. And
I'm gonna hit you with my clavicle.
Oh, bang! I got it. That won't leave lasting damage. So when I get into the gym, my shoulders just hurt all the time. So and fortunately, I was studying physiotherapy at the time. So I start learning about all, how to work with rotator cuffs or, thoracic mobility. This is back in the 90s when no one's talking about this stuff. So I've been, playing around with thoracic mobility and scapular stability and strengthening rotator cuffs and dynamic stabilization, which then got me into kettlebells. So I go, well, having that injury led me down this path that has been so beneficial over the years. But if I could have learnt those lessons without an injury and without pain, I will take that every day of the week.
Yep. But for some reason, we end up learning that stuff afterwards because it's almost like we just don't learn that stuff in that level of detail until after the injury. Like I continue to learn, At least in my experience, I continue to
Yeah.
learn. I continue to try and learn more and more about the human body. But for, like you said earlier, as soon as I got an injury on one part of my body, it's like I became an expert on that one part of the body. I learned every single thing, and then everything that branched off of that part.
Yeah, right. And so you end up, yeah. I just once again, like really, really, really similar. Like I think you, I think you need a strong motivator to search for different information. And I think it's been really obvious for both of us that we like to do things ourselves. So when we've got an injury, we want to find out what to do about it. But in order to guess what injury you might have in the future, that's a little bit harder. And so doing all that pre-preparation to go and go, well, maybe one day I might have an ankle injury, so I'm going to become an expert on ankles. I don't think
Right.
if anybody's ever done that, if anybody's that smart, I'd like to meet them because I was never that smart.
Yeah.
But admittedly, other people's injuries with ankles did get me to be an ankle injury expert. Because I started. We have a sport in Australia that I don't think you guys have. We call it netball. Have you ever seen it?
Netball?
Netball. Yeah, it's it's
Where you hit it on the ground
Nah,
into a net, or
it's modified basketball for women.
okay?
It was originally invented as a sport only for women, and it was modified for basketball because apparently, like this was the thinking back when it started, women are so fragile and weak, they shouldn't be running all the way up and down the court. So it's a game where you can't run with the ball and you can't dribble and you have to stay within certain zones. So you end up, so it's played in Australia by super athletic young women who are all over 6 foot, like these Amazon style women that can sprint and jump and run. And they should be playing basketball or football, but they play this weird sport where they stop suddenly on a dime all the time and they roll their ankles. And so from like the age of 6 or 7, you've got, young girls in ankle braces trying to hold their ligaments and joints together from playing this weird game that only Commonwealth nations seem to play. So because I was seeing people like that all the time around me, I figured there's got to be a way to start preventing this stuff. So that's where I, went down this neuroscience route and looking at ways of preventing injuries that weren't just about how do I strengthen the joint, like how do I do stuff that means that we don't need to strengthen things, we can just respond properly.
Yeah.
So in that regard, I think doing the old is it a gift? I go, well, possibly.
It's a gift that I'd like to return.
Oh,
I
yeah.
don't return to sender. I don't want it.
So I've got two ways here. Like there's a few things that come out with always being in pain and working through pain. Um, I'll go to this question about movements while you're in pain because I don't know. I'm of the belief that movement is the therapy, and that's what we're trying to do all the time. We're always trying to get people to move better, and movement is how you get out of pain. It's also how you get into pain quite often. So it's probably what we should be doing to get out of pain. So question 5 was, what kinds of movements or activities, in your experience, are really good for people experience pain conditions?
I think it depends. Number one, it depends on what pain conditions you have.
Yeah.
Right. That's right off the bat. Number two, if I had to give like a blanket statement, I would say anything that you can do that doesn't cause more pain and increases strength, increases range of motion throughout the joint, throughout the muscles. Those are things that you want to lean more towards. So, for example, if you have back issues, stuff like that, you want to. Walking is a really good passive way to decrease pain and get exercise in and increase your steps so that you can stand longer, you can do more things. It'll lengthen your hip flexors. It'll actually correct the way your hips sit. So that, because if you sit a lot, your hip flexors get short, your back kind of like arches when you stand up. It kind of screws up the way you stand. So walking is a really good one. But on the other hand, if you have bone on bone arthritis in your knee, walking for a long time isn't really too conducive now, is it?
Yeah, no.
Or if you need a new hip, you really can't do that. So walking every, maybe taking sporadic walks, or maybe swimming is a better option for you. So to kind of come back full circle, anything that you can do that. If you have to regress the exercise, regress it as far as you need to. If it's push-ups, do push-ups instead of bench press. If you can't do push-ups, do incline push-ups. If you can't do incline push-ups, do push-ups on the wall. If you can't do push-ups on the wall, take a very small exercise band like the ones in physical therapy and press against that.
Yeah,
Wherever you start there,
yeah.
and then progress from there and build from there. But your body needs to know that it's doing something and it needs to get better at it. That's kind of my general answer.
Man, I think once again, we are in 100% agreement on that one. I talk to people about we have rules around pain. But number one is we got to move. Like that's the whole thing. Like we've got to move. And it's just anything, just any movement at all is going to be better than no movement. However, if there is pain, I would say number one, do it slower. Just slow down and see if you can get rid of the pain just by doing the same thing that you're doing, except a little bit slower. And so sometimes I found going so slow that we're not moving at all, and you're just contracting. That's where we're starting from, like an isometric. Just flex the muscle, just do something because there's still a little bit of movement there. And then we go, okay, so can you flex it 100%? No. All right, we'll just do it smaller. I can go at like 60%, there's no pain. And go, can you go to 70? Go, no, pain at 70. All right, we'll just work at 65 or 68 as often as possible until it slowly expand what you can do. But the only rule is that you're not allowed to stop moving. So just find any movement you can to keep going. And that seems to work pretty well. So do it.
Yeah.
Go slower, go smaller.
Right. I was gonna mention the isometrics, and you brought it up, and that was perfect. Also,
so good,
negatives are great too.
Yeah.
Negatives are great. Wall sits is basically a negative, but this is the only time I recommend sitting into the pain. If you have like knee pain, like a tendonitis or tendinopathy, do a wall sit. Find the position, the angle of your knee where the pain hurts, and sit into that position and hold that isometric. You'll notice that it's a lot of the times it's not the actual tendonitis that's causing the pain. It's more of a neuropathy. It's more of your brain shutting off that muscle because it got hurt at one point, and it's saying, I'm going to send more pain here so that we don't get hurt anymore. And you have to tell your brain to shut up. I'm not hurt anymore. I need you to stop sending pain signals so that I can move on with my life.
Yeah, that's a really good. I'll pick up some of the neuroscience there because that's a really good point. If you start looking at pain science, there's a lot of definitions over the years for what pain is and what it isn't as well. And pain is number one. It's a subjective experience and it's an output of the brain. It's not an input, so it's different to nociception. So it doesn't necessarily mean that there's tissue damage when we have pain. Sometimes it's exactly like you said. It's just constructing a story based on what has happened in the past. And that pain signal is an action signal to do something differently. That's it. It's just an action, just going, hey, at the moment you're moving in such a way that the system doesn't feel safe, doesn't feel protected. So in order to feel safe and the survival imperative, we have a pain signal to say, just pull back. That pain signal doesn't necessarily mean you're hungry. I'll tell you this funny story to demonstrate. Sorry, sometimes it just means you're hungry, not that you're hurt. This fella was a rugby player. he would come in to the gym that I was at the time, and he wasn't one of my athletes. He had a couple of different coaches, and he was one of these people that people were always doing like drive-bys on him to try and help his shoulder pain. And he's going this and this and this, and we'll just talk. And so one day, I threw him a Snickers. I literally threw him a Snickers because those Snickers ads used to make me laugh. You're acting like Betty White, man.
Yeah.
And so I go, dude, try this. He had a Snickers, and he had some of his he had his pre-workout shake, and he waited 5 minutes. I go, how's your shoulder now? And he goes, there's no pain. There's no pain. I'm going, yeah, it's not. It doesn't. Just because you get a pain signal doesn't mean that you're injured. I said, you were injured 6 months ago. Definitely. There's definitely tissue damage at the time of the injury, but there's none now. It's healed. It's now this latent thing that your brain's just trying to protect you. It's an overly cautious nana. Doesn't want you to get hurt again. So rather than give you everything you need to go back into that range, just give you a bit of pain signal. And the action signal there is just going, hey, pay more attention to what you're doing. So like with the isometrics, like I've experienced that one where patella pain over the course of a 1 minute isometric, the patella pain just goes away eventually.
Yeah.
Because I know there's no damage
away. It's like magic.
Yeah. I met a guy playing rugby a few years back. He was a referee. And like you were saying before, how you get an injury and you research it. This guy was not in a field normally associated with dealing with people. He was like something in sales, but he blew out his knee massively and he completely ruptured his ACL. And he was told, like everyone that ruptures their ACL, oh, you need you're going to do X, Y, Z, and it's going to take this long, and you have to do this. And because he's Australian, he's a little bit oppositional, and Australian men, we don't like being told what to do. I think we'd fit in New Jersey or Pennsylvania. Just go, no, you're not bossing me.
Men in general.
And you tell me I can't do it, that's what I'm doing. And so he didn't get surgery, and he found out how to basically heal his own ACL. And he's on YouTube. You can search for it on YouTube. He had a channel for a while there. It's really interesting what he did. But he's regrown his own ACL and regrown cartilage. Like all these things that we're constantly told that's not possible. It's bullshit. It's really possible. I got
to check that
out. I have MRIs. And so I do a lot of the stuff that he does because my left knee is full of arthritis and been in pain. But over the last few years, the pain's almost gone away. And each time I have an MRI on that knee, my surgeon says, it looks like the dates are back to front, doesn't it? I'm going, yeah, I know what I'm doing. I don't want you to cut me open again. I'm highly motivated to not have surgery. So I've literally regrown cartilage in areas of my knee that apparently you're not meant to be able to regrow cartilage, according to
Well, when this is over, I need you to send me that.
Yeah. And literally it was just lots and lots of isometrics. Was the bulk of it is just, and following those rules that we talked about. Like you still got to load it. You can't avoid it. Just find ways to load it and to load it safely without pain. So yeah, like my surgeon he's told me for years, every time I see him, he goes, I'm going to give you a fake one of those one day. I go, no, you're not. He goes, there's this really, really great company in Boston that make these bespoke knees and it's going to be so good, Nathan. You're going to love it. I go, not happening, pal. Not happening. I don't want
over my dead body.
I like the parts that are in there at the moment. I'm gonna work on those.
I got enough metal in my body. Yeah. I don't need any more.
But I think there's a lot of things like that. The conventional wisdom says this is the way you do it. This is the only way. And I like challenging that idea that there's only one way to do things. I think there is other ways if people are willing to explore. But in saying that, if you just want to take the meds and sit on the couch, totally your choice as well. Just not something I would recommend.
Yeah, completely agree.
So in saying that then, what are your thoughts on medicating through pain? Where do you sit with that? That's a big open area, isn't it?
Yeah. If we're talking about like medication, like drugs type deal, stay away from it completely.
Like
most
about
meds,
like opioids, things like
because let's face it, those are the only drugs that are going to be strong enough to help with most pain for most people.
Yeah.
And the downside to them is they are highly, highly addictive.
True. Yeah.
And they're going to most of them you can't stay on for more than about 10 days without becoming slightly addicted to them,
I
if not full blown addicted to them.
you would have heard you've heard stories, right, about how quickly people that, like, I know guys that just don't touch drugs at all. They have surgery, and all of a sudden they realize they're asking for an oxy 2 hours before they need one, and they're not actually in pain yet. They start going,
Yep.
"Oh yeah, I need one. Oh, hang on a second, I'm not in pain.
Yeah.
Why am I reaching for a box of pills?"
Yep.
It's
Yeah.
it's kind of
Your
scary.
body literally creates more pain to get that drug.
Yeah.
It's just like any other hard drug. It's like heroin. It's like it's such a horrible, horrible thing to do. Go back to the movements like we were talking about. Movement will bring your pain down. It doesn't feel like it in the beginning,
Mm-hmm.
but you have to be diligent. You have to keep going. It will bring your pain down. Medicating I do not recommend it at all. There is no end game.
Yep.
There is no end game to medicating through pain. Now, if you've had a major surgery and you need it, then maybe for the first couple days. But for me, I've had surgeries. I always tell them don't even bother because it doesn't even do anything. I just get the
Really?
negative side effects. Like, yeah, I'll get like vomiting and dizzy and stuff like that. I have a really high metabolism. That's what they told me. That's why
Right.
because they've given me morphine, ketamine, tramadol, everything. Right? They've given me everything. Nothing has done anything. It was like popping Tic Tacs. Now I am on Cymbalta, which is a nerve thing that kind of messes with the chemicals in your brain.
Mm-hmm.
That's the only thing that's kind of helped me, but I have a nerve problem.
Yep.
Most people don't have that kind of problem. They might have like knee problems or hip problems or shoulder problems, and they want to take these opioids, and it's the worst thing you could do. It's If you're better off, just keep moving. There's plenty of lifters that have completely blown out shoulders and they still lift, and they don't even know their shoulder's bad until they get an x-ray.
Oh yeah,
So
you're talking about me right there.
you see what I'm saying?
Like I
Strength.
yeah.
Strength will support the joint. Your muscles will support the joint.
Yeah, big time.
So
Let me give you an example on that. Like obviously I just had 2 shoulder replacements. The first one didn't work properly, so I had to get it redone after a year. And people say, was it from bench pressing? I said, absolutely not. It was definitely from rugby and the abuse, the impacts, and then powerlifting held it together for so long. Because we know absolutely 100% from the research and from lived experience that the stronger the muscles are either side of the joint, the less pain you'll experience. Like
yep.
it's a very straight line relationship between how much muscle is supporting the joint versus how much pain you're in.
Yeah.
So
It's kind of simple when you
yeah,
put it that way.
it was only from losing a lot of strength when I stopped lifting and I had all the heart stuff going on, so I wasn't training whole lot, lost a lot of muscle around the joint. That's when I started feeling pain, and it was pain from being on a computer or writing. It wasn't pain from being in the gym. The things that hurt
Yep.
were using a mouse for too long on the computer or things like that. And I still maintain that was just from getting weaker over time.
Yeah. That's kind of just the gist of it. Because when you think about it, most people just age. They never strength train,
Mm.
and then they hurt as they get older. Oh, you're in your 40s. Oh, you're in your 50s. That's kind of part of it. No, it's not actually part of it.
Yeah.
You look at somebody that grew up and lives on a farm. They don't hurt. They're 70 years old. They still work on a farm. They don't have any aches and pains. They get up at 5 in the morning.
Yeah.
They work the farm,
Yeah.
and they go to bed, and they get up like any
Yeah.
other 15-year-old. They're completely fine because they keep moving.
I love chatting to like guys like David Ricks or Damien.
Yep.
How do you say his name? Dr. Damien. I'm just going to call him Dr. Damien. You know who I'm talking about. Like they're all in their 60s, still lifting huge amounts of weights. And you hanging out with them in Norway this year, you go, what do you guys do? What's the secret? I go, and David just says, oh, I never stopped. That's all.
Yeah.
I just kept going. And I'm like, I think that's My friend Peter Day said the same thing. She's M3 and still getting all-time personal bests at M3. Like she started as an M1, but yeah, all-time personal best into the M3 category. And she goes, "You just keep going, just keep turning up, and as long as you keep turning up and just moving a little bit, just keep on doing something,
Yep.
you're all right." I think it's like you said, it's when we stop. We go, "I'm not doing anything anymore. I'm not going to move." I think that's the point at which things go sideways.
Yeah. They start hurting.
You make a really good point about pushing back against that story of, oh well, you're old. You're meant to be in pain when you're in your 40s, or you're meant to not be able to do stuff when you get to 50. I'm not sure about that. I like moving. I think you can do it.
Yeah, well, I mean, when you hear the people that say that, and you look at their life and you listen to them, they've never really done anything active. Or if they have, they haven't done it since high school.
my friend Andrew Reid out here in Australia, I think he actually enjoys pissing people off sometimes. But he makes comments about that all the time. How people say, "Oh, well, you're going to get bigger as you just naturally, your waistline naturally expands and you gain weight as you get older." And I said, "What? Because you haven't exercised since high school and you're wondering why you got bigger?" I'm like, "Yeah, that makes sense. Like, you don't need to be gaining fat mass as you age. You don't need to be adding pain as you age, just as a matter of course. It might happen just because you've lived longer, but it doesn't mean we have to accept it as that's the status quo and you can't do anything about it."
Right. I mean, eventually you're going to lose muscle mass, especially as a man, because we kind of peak at a certain age with testosterone. But I could tell you for a fact, as I got older, my bone density got higher. So, you know what I mean? Where everybody else around me started getting bird bones and just breaking them, falling, they'd slip on ice and fall and they'd shatter their legs, where, I could probably run into a brick wall and the wall would break. Like they take x-rays on my bones and they're almost completely white. There's no hollow parts on, you know what I mean? When you look at an x-ray and there's like the dark parts.
You're just adamantium by this stage, aren't you?
Yeah. It's just pure white when you take an x-ray of me. It's ridiculous looking. But that's from 30 plus years of just strength training. My mom has osteoporosis, right? And a small little part in her forearm. And I told she got really worried. And I said, "Don't worry about it. We're going to continue to strength train. And it might, especially with the pill, we can probably just keep it where it is. It won't get any worse. It won't spread to your back. It won't spread to your hips. We'll keep it where it is. And we'll keep, making your bones denser and denser. And, you'll go into the grave with these stone bones." And so, that's kind of what you do. You got to strength train. Anybody, any age, start strength training. I don't care if you're 95 and you're listening to this. Grab a can of corn and start doing some curls. Wherever you got to start there.
I'm just laughing at the fact that two strength guys are saying, "Yep, answer for everything is just get stronger."
It kind of is. It's kind of the fountain of youth.
It seems to be. It really does.
I mean, we're not saying to become, what we were. We were trying to see the potential of our genetic limit, our unique genetic limit. We're not saying that. We're just saying strength train. Pick something up that is heavier than your arm. Pick something up that is heavier than your leg.
Yes.
Make your body strain and stress a little bit, cause a reaction so that it has to adapt and build muscle. Make your ligaments and tendons stronger so that the connective tissues in your joints are more resilient to being injured. These are the things. The discs in your spine can actually become more dense when you run, when you jump, when you squat. You can become more resilient overal if you just do something. I don't know how else to say this. Like, I want to scream into this microphone. Stop that! You know what I mean? But I don't think anybody's going to listen. Like, people listen with their ears plugged.
I think we've covered that question of does training with pain always increase the pain. I think we're going, no, it can, like if you're a dummy about it, but really movement is about decreasing pain. So
Right. Say the question again.
so
Can
the
movement?
question was, does training with pain always increase the pain? So I think that's like the up to it's the word always. I'm going,
Yeah. I want you to go first because I want to hear the neuro part of
yeah.
this.
The correct answer in neuroscience is always it depends.
That's kind of what I was going to say.
It depends, and maybe. Um, so I think there's a lot of caveats with that question. So the traditional notion of pushing through pain and changing nothing about what you're doing other than just applying more force, yes, that will cause more pain, more damage, always. But if you use the pain as an indicator to do something different, then training not through and not with, but kind of on the outskirts of pain. I'd probably go. That's where we're trying to aim for. We're trying to use pain as I guess, like a guide to go. Not here. Don't do this. Do something else. So in that regards, I think having pain in training. Well, how to put it this way? Training in pain for me will often make my technique better, because I find this really narrow window of perfect technique that if I hit this perfect technique, if I really lock in, and this is my rehab at the moment, if I really lock in my lats properly and keep my elbow perfectly in the groove, I have zero pain at all. But if I get a little bit loose, if my elbow's out of position a bit, I feel it. But I have
Yeah.
to remember to go, don't stay with that pain. Don't live there. Use that as the indicator. You're doing something wrong. Move away from that. So that's
Right.
would be my take on training with pain.
No, I'm with you on that. I'd like to add that it depends on if it's muscular or if it's joint. So or if it's ligament or tendon. So
Yeah.
see, this question is kind of vague, right?
But
And
that's
I
where people are
understand that,
with pain, though, aren't they? Like the way we
right? Because
describe
they're not
pain, because we have one word for all of everything. And like you
right.
said, it's really different. It feels different. The experience is different, and what you do about it is going to be different.
Right.
Uh,
And that's why follow-up questions are important for people in general, right? Because they are in pain. They just don't know what kind of pain they're in.
yeah.
And that where the next steps come in.
Yeah.
So I'm going to kind of run through it quick because I could talk for an hour on this one thing alone. If your pain is from arthritis in the joint, there are going to be certain movements you can't do at all, right? So say you have a shoulder arthritis.
Mm-hmm.
Overhead pressing is kind of a no-go right away. Can you do it? Yeah, it's going to be painful and it's just going to cause more inflammation and just more grinding, especially the certain kinds of shoulder arthritis, impingement, and you know what
Yep.
I'm saying.
Yep.
So try bench pressing, try shortened range of motion bench pressing, try dumbbell bench pressing, try isometric, stuff like that. Things that don't hurt, right? Things that make you feel better,
Mm.
like we said earlier. If your pain is muscular and it's because you're sore rather than, like, say you're beginning and you're just overly sore, maybe pull back on the frequency of the amount of times that you're training, or pull back on the volume, how much work you're actually doing in that day. If you're just beginning, because that pain can really kind of trickle over into your ligaments and tendons and cause tendonitis,
Mm-hmm.
tendinopathy, and that can trickle over into snapping a tendon or snapping a ligament, because you don't want to have turn into tendonitis, tendinopathy, because then you get macrophagia and all this
Mm.
other kind of crap in your big words, right? So,
Bad words, bad things happen.
right,
Nothing
exactly.
good happens
So,
down that way. Yeah.
will training through pain always cause more pain? Depends.
Yeah, it
It
can.
depends on where your pain is coming from. So again, like we said, if it's arthritis, find a movement that doesn't hurt it. If it's ligament or tendon, then you need to back off and do specific training for ligament and tendon training, because that's very different.
Mm-hmm.
If it's
Yep.
muscular, then you're just doing too much. Back off.
Yeah. Yeah, I think it's really important there as well to distinguish between sore, hurt, and pain. Um, there's a lot of
Right.
actually.
Right.
There's a great book called two books by Lorimer Moseley and David Butler called "Painful Yarns" is one of them, and the other one is "Explain Pain." And so there are a couple of neuroscientists and doctors, pain researchers that put out some amazing research and resources to help clinicians deal with people in pain. And one of the big things is educating people around pain. And the more words you have to describe your pain, the less pain you'll experience. So if it's just one big blanket word, oh, I'm hurt, then it's kind of big amorphous blob. But if you've got like a very specific word for the little twinge you get in a tendon, and it's a different word to that arthritis-y pain you might feel in your knee, and it's a different word to that old ankle injury that keeps on coming back to haunt, your experience of pain will be better.
Yeah.
Yeah.
Yeah. Completely agree. Yeah.
Just
sure.
showing some nuance about what your pain is. And then the other one was trying to be forgetful about pain.
Interesting.
Especially when it's that kind
of like living in it.
Yeah, so
like you're always thinking about it.
Yeah, you know how like you would have experienced this, I'm sure. Like for years, one of the things about having that arthritis in my hip was that I was always aware of my hip, and I'm always thinking about it. And my focus goes there, and the more I'd focus on how my hip is today, my pain would always go up. But if I could forget that I was in pain, it would go, let's just find a nice gentle movement and go and not try and search for the pain. Because I think that's one way that we can often recreate pain is we're trying to search for that hurt feeling again. To remind us, oh yeah, that's right, that feels bad. And so if you keep on searching for something, eventually you're going to find it. So if instead you change the focus to what feels good and forget that, there are movements that feel bad. We don't need to worry about that now. Forget about that. Focus on what feels good. That can often have a big impact in your subjective experience of pain.
It's a good point,
because there's a huge
social. It helps your mental state.
Yeah,
it helps you keep motivated to keep going,
which then reduces pain.
Right,
things like
exactly.
depression and anxiety increase the experience of pain.
Right. That's a good point. Yeah.
The emotions that we experience around pain, like pain. Have you noticed? We don't talk about this, but pain always comes with an emotion. There is always an emotion present with pain. It's either, for me, it used to be anger. Like just get really angry about my body not doing what I wanted to do and I'm in pain. Or I'd get really sad or really depressed but it's one of those sort of categories of emotions generally. So there's always something there to deal with. And, the stuff around emotions then leads you into, well, what are ways you can manage your emotions around pain in order to modulate how much pain you feel? So if I feel sad about being in pain and I pour myself into that sadness and go, yeah, it is really sad. I don't get this and I've lost this, and I really try and make myself sadder, I will experience more pain as a physical sensation. Like I'm literally creating it. If I do, and this is why meditation is so often recommended for chronic pain. If I go, you know what? Yep, I know my hip is damaged. Yes, it is sore. Can I just sit here and be okay with being a baseline 2 out of 10 pain? Can I acknowledge that I'm in pain and not respond to it with anger or sadness or anything like that? Just go, yep, I'm in pain and I'm neutral about it. I'm never going to be happy that I'm in pain. But if we can get closer to a neutral emotional response to pain, then pain experience gets better.
Yeah. Yeah. It kind of like reminds me of like in the beginning when I would just be angry and sad and upset and depressed. And when I would find something like to watch on TV or my phone, even for like a few seconds, I noticed for those few seconds, I wouldn't be in pain
Yeah. Yep.
until I laughed, of course, and then now that would hurt it. But
Because then that's actually a
and I was
physical thing that then becomes nociception, right? It's not.
so
Yeah.
it's kind of like one of those things where it was kind of like a loop, but that what you're saying makes complete sense. So it's like it's almost like you're distracting your brain, saying, "Hey, shut up! I don't want to feel any pain right now. I'm going to watch this, or I'm going to think about this, and not feel any pain, or the pain's going to be way down compared to where it normally is."
So if you think about the neuroscience of it all, we think about sort of teleologically, like why we experience pain, what it's trying to do for us. It's a survival thing. It's trying to stop us from hurting ourselves and then being a threat to our own survival. So if we can calm our nervous system down by going, okay, I acknowledge that there's pain. I can, I'm feeling it. Yep, it's in my, I don't know, right part of my neck or something. But I understand that it's not a threat to my immediate survival. Because quite often the way we respond to pain is with this big emotional response where we start leaning into the fact, oh, well, I might die. I mean, my shoulder is going to blow up or whatever. And we kind of create that atmosphere where pain can grow. If we go, all right, yep, it's painful. I'm doing stuff about it. I'm going to be in pain for a while. It's probably going to be with me for the next 3 to 4 months while I go through this rehab. And just accept that it's there. The experience of pain is so much better. I can't begin to describe how much easier life becomes when you just go, okay, it's going to be with me for a little while, and I can
Yeah,
carry it.
yeah, it's good. It's good knowing that there's an end to it
Yeah,
too.
that's why I found surgical pain and rehab so much easier than chronic pain, because chronic pain, as
Yeah,
you know, where does it end?
it doesn't. There's just waves
Mm.
of bad and really bad.
Yeah, bad and
You know,
worse. There's no
yeah.
good. There's
You
no
just,
good there.
you kind of just have these moments of these moments where it hits you and it's almost like euphoric, where oh my god, I'm not in pain right now, and it
Mm-hmm.
doesn't last very long. But you sit there and you can feel like the dopamine in your body, like it's you get so happy, you're like, I'm not in pain, and then you don't want to move. You're like, I'm not going to move because if I move, it's probably going to cause some pain, so I'm just going to sit here motionless. But
This is
that's how people get stuck in chairs and they don't move anymore. So
right. Yeah, and I
I
think
get my
that
ass up and I go walk outside.
I think there's a question. I'm just going through here with there it is. The question was, my own chronic pain exhausts me when it flares up. It's not the pain so much as the disruption to my calm that annoys me. Do you have any advice? I think that's what we're talking about now, because it's incredibly tiring being in pain, isn't it?
Yeah.
And it's layered.
Physically, mentally, emotionally,
Mm-hmm.
all of it wrapped up into one. It's overwhelming
It
sometimes.
really can be, can't it? Especially when it comes in those waves that you describe.
Yeah, especially when it flares up like that. It's just you feel like nothing is gonna fix it. Nothing's gonna make it better.
Mm-hmm.
So I guess what was the actual like question on?
Yeah. Any advice in dealing with that exhausting side of chronic pain?
Find something that you really, really love to do.
Mm. Yeah.
Now, for people like me and Nate, unfortunately, it was taken from us.
Yeah.
Now we can do it to a very low level. We can kind of, get in there and throw a bar around a little bit. But if you are fortunate enough to where you can find something and you really enjoy doing it and it does not bother you, that'll give you motivation and something to look forward to. And your mind will focus on that rather than the continuous constant pain that you're in.
Mhm.
At least that's what I've found. I've worked with
Same.
wood for as long, so you get what I'm saying. You've had the same deal.
Yeah. Yeah.
You just
Just
got to
find,
find something.
just, and it doesn't matter what it is, just anything.
Yeah, anything that you like to do that gives you, um, makes you happy, makes you think,
Hmm.
makes you learn. Um, like I was saying, I've worked with wood just about, if not longer than I've been training with weights.
Hmm.
And recently, it takes me a lot longer to build things, but I've been building things. I've been refurnishing furniture, and I've been getting back into that. It'll never meet the, the happiness or whatever you want to call it that the powerlifting did, but it is a close second. And I get to build something. I get to learn more skills. I get to use my hands again.
Hmm.
Um, so try to find something like that. It does not have to be with your hands. It could be puzzles. It could be anything. Just try to find something. That's my advice.
Where is mine? This is what I'll see if I can angle that. That was mine for a while. See up there, the
What model cars?
yeah, Lego cars.
Oh yeah, oh man, I went through that phase too.
Man, it's just I like Lego is so good. You know when you
I
get
know.
when you realize like your hand, you sort of got this kind of golem posture because you've been going for 3 hours because you just want to. I just want to build Dom Toretto's engine and then I'll finish.
I was I was up till 3:30 in the morning one night because I wouldn't stop finishing this stupid puzzle, this stupid Lego. I can't even remember which one it was. I think it was a Harry Potter one.
Oh,
And I'm sitting over and I'm going through those. First of all, their instructions are perfect.
oh,
They're the best
right.
instructions of anything. And I'm going through and I'm like, this piece, this piece. And I'm going, and I look up at the clock and it says like 3:37 a.m. And I'm like, I did it, but I'm exhausted.
Oh man, I've got like Dom's Charger and the Robert Pattinson version of the Batman car. That was fun to build.
Oh, that's cool.
Formula One cars. That were hard. They were really hard. The Formula One cars, especially with these sort of bare paws that I've got. But yeah, just
Yeah.
so fun. And then a big reader of fiction. And like you said, it doesn't quite. It's not the same as for me standing on the platform of the Arnold Classic. I don't think anything's
Right.
going to. Nothing can replace that. But there's other things that still feel good, and I can tell stories. I can relive the glory days. We can reminisce. We can um, get blokes like you and me and Jonah and Jeff and guys like that on the podcast. We talk about how much fun it was, but it's not going to happen
Hmm.
again. And I'm okay with that now, as long as there's these little bits of joy here and there, and they're frequent enough to fill in the gaps. And I think
Yeah.
that's one of the big things there is that they do need to be, in my experience, they need to be a bit more frequent. I know if I don't do them all the time, I can easily drop down and really miss what I used to do. But if they're regular,
Yeah.
like if they're a daily regular practice, it's kind of like it's looking after your own mental health as much as anything by finding enjoyable activities.
I was going to mention that I find myself doing like the woodworking and stuff constantly. It never stops. And I think that's just because of the chronic
Yeah.
pain. I'm always looking for, um, an out, a fix. If but that's kind of like that's where people take drugs too.
I was gonna say
And
that's the
that's why
yeah.
right. That's why I'm always saying do not reach for the drugs because it can become very addictive in that sense. I'd rather be addicted to building furniture than, you know,
Right. Yeah. So
taking some
there's
pills and waste away.
a concept in psychology that we talk about of either avoidant behaviors or approaching behaviors. And with pain, we're constantly trying to avoid the pain, and we're just doing anything to avoid. And so that's where medication and drugs become really, really attractive because they are good at avoiding that pain, but you end up in a place that you don't want to be. If we start thinking about it as, I want to approach a behavior, I want to approach something. So I'm not worried about running away from the pain, but I do want to get to the thing that I enjoy, which is, well, in your case, woodworking. So the whole hormone cascade and neurotransmitter cascade, when we look at it in that direction, in the positive direction, is wildly different to avoidant behaviors. And so you have a different inflammation process when we're trying to avoid things, because it's fear-based, it's a little bit flight or fight. So there is the reliance on a little bit more adrenaline to get it done, a little bit more cortisol in getting it done, because we're just trying to outrun the bear at this stage. Like that big, scary bear that is pain, and we're just trying to get away from it. That is really tiring. It doesn't make you feel good. There's no joy in it, because at best, you just get away for a little while. But if I go, well, I'm not just outrunning a bear, I actually want to go to this lookout over here, and we have a positive target, then we're not using so much cortisol. We're not using adrenaline to get stuff done. We're using, we start talking about dopamine and anandamide and endorphins and serotonin to generate motivation, not just fear-based motivation. So I think in terms of that, being able to stay calm, the advice I would be is start thinking about an approach behavior rather than just the avoidance behavior.
Yeah. I think we're on the same page so far, man.
Yeah, you're right. It's all lining up.
We got to start disagreeing at least on something.
Let's see what we can get then. Do you have any insights or experiences with? I think a two-part question. We'll go CBD oil first. Do you have any CBD oil experience?
Yeah, because I tried everything. I was basically a human pharmacy in the beginning. Once I knew I wasn't going to compete anymore, I put everything in there. So I tried CBD, and it worked a little bit, bring down the inflammation.
Glad you said that, because that's all it does. It is a very good anti-inflammatory. Wonderful. But that's its range. So if your pain is caused by inflammation, it's a good use. Way better than NSAIDs or ibuprofen or something like that.
Exactly, because I couldn't take ibuprofen every single day. When I was basically peeing blood out of my butt.
I was going to say that's a great way to destroy your liver and give yourself a whole lot of problems.
I was like, well, that's a lot of blood coming out of me. I'm going to stop doing that.
That can't be right.
Yeah. I was like, you should have seen my face, man, when I got up. I was like, oh no, I'm dying.
Right? Is this cancer? What's going on?
That was my first thought. But I was like, great, that on top of this. So CBD, I took a couple drops. It brought the inflammation down. I was like, wow, that actually helped a little bit. And then what happened with CBD was I quickly became help me out with the word here,
tolerant.
What's that?
Became quite tolerant or adapted to it.
Tolerant, right? I became tolerant to it very quickly. So 2 drops became 4, 4 drops became 8, 8 became 16. Eventually, I'm taking down like half a bottle at a time, and it's not doing anything anymore. And I'm spending a lot of money. And then I come off to try and let my body reset. When I came back on, it didn't do anything. So for some people, I think THC, CBD kind of works for them. I think it just depends on their body.
And it depends
I don't think it's a long term.
It also depends on the condition.
Right, exactly.
This is coming from my time in cannabis research. That was all my honors research was the uses of different elements in cannabis for schizophrenia treatment. And what we found with CBD was, good anti-inflammatory. So if your pain is inflammation-based, and that would mean that it is fairly recent injury, then CBD will have a nice little effect. But if that's not the extent of your pain, it's going to wear out pretty quick, and you're not going to get anything from it. It may increase the potency of some other medications you're taking, as most oils will. So that's always something that is really important to consider, that if you're taking CBD oil along with regular medication, you're probably increasing the effects of other medication.
Hmm.
And that's not what people get told, which is sometimes a little dangerous. THC has mild pain relief effects, but they're transient. I think CBD gets thrown out as like a panacea that it's good for everything.
Yeah.
It's not. But what I love about CBD is it probably won't hurt.
No, I think curcumin is kind of in the same realm as CBD. That can kind of do the same thing as an anti-inflammatory. And these are CBD and curcumin are both things that you can take basically indefinitely
Yeah,
without damaging yourself.
yeah, I like that about plant-based medicine. It's not going to have the effect that you want it to do.
No,
It's not going to feel like taking drugs from a pharmacy, but it's going to have an effect, and it's going to be slightly positive, and it more than likely won't be negative.
right. And like you were saying, if you had an acute injury and you're trying to get the inflammation down quicker to try and rehab faster, then that might be a good route to take. But if you're in chronic pain, I don't know.
Yeah.
And it depends on what kind of pain you're in or where the pain is coming from.
Do you ever use
Now,
THC for pain?
I tried it. All it did was make my eyes really heavy, and and that was about it. It didn't do anything for the pain.
Right.
I took the gummies because I don't like to smoke at all.
Uh-huh.
I've never smoked a day in my life. Um, so yeah, I tried the gummy. I took one gummy. It didn't do anything, and wrongly, I took a gummy too quickly, and they both kicked in the same time. So I was like way overdosed, and I instantly just went. I looked like every movie where you're just like super stoned. I'm like, oh my god, why are my eyes so heavy? Yeah, exactly.
I want pizza
And
and ice cream right now.
everything,
Where's the peanut butter?
yeah, everything was funny. Everything, the stupidest thing was funny, and I was like, I don't like this. I feel like I'm not in control. So I never took that again because I'm there for for the pain relief, not for the giggles.
I don't mind disclosing because it's legal here now in Australia. I've been on a prescription with THC for years. I find it so helpful, but I only find it helpful because I work really hard at getting the dosage right. So I don't have those heavy eyelids or just sort of walk around in a stupor or sit on the couch for hours at a time, unable to move. Like, I don't want those effects. I just want, and this is what I find quite helpful, and um, maybe sometime I can go into the neuroscience of how, it's in the body, the CB receptors work, and the retrograde transmission. It's a really fun area of neuroscience to try and explain. But no one cares. They just go, I feel stoned, I feel happy, and I want to laugh. But what I'm trying to do with it quite often is just give me a little space and time, so that the pain and especially the emotional response related to the pain doesn't seem quite so overwhelming. So combining, and it's funny that the second part of the question was, do you have any experience with meditation as well? I use THC flower with meditation in order to just give me that space to then work through the pain and find ways to move better. If I take too much of it, I'm not going to move. And so it's like, well, that defeats the point. But at a certain level, I find it very helpful just for creating space and creating options to move differently.
So you're using the THC to get you into a calmer state, and then when you're in that calmer state, that meditation is really putting you into a really deep meditative state.
That's right.
Cool.
And then you
never thought of it that way.
It's also because, I talk about flow a lot, and part of the flow cycle, you watch the map. If you map the neurotransmitters, we kind of start out with a lot of adrenaline or norepinephrine and a lot of cortisol. That's the start. That's like the frustration, the startle, the scary thing. The next part of the phase we call release. So it's that you feel the fear, and then you kind of, all right, do it anyway. You know, you look at the big scary weight on the bar. Oh shit. And then you go, all right, focus. When you flip that switch and you go into focus mode, the neurotransmitters involved are nitric oxide. So you have this big calming effect, and anandamide. They're the big two. And then inflow is endorphins. But going into flow, a lot of dopamine, a lot of anandamide, and a lot of nitric oxide. So you actually feel high. It's
So the nitric oxide, I'm assuming, is the driver. It's pushing everything through.
so it's if you
Or am I wrong? Am I
yeah
wrong on that?
kind of yeah you're kind of right. So the purpose of having so much cortisol released instantly is so that you have a big release of sugar or energy into the bloodstream. So it's mobilizing.
Okay.
We've got all the energy now. Adrenaline is going to push your heart rate up, but it also increases your blood pressure. So we've got more nutrients flowing through the body. Nitric oxide takes these constricted arteries that are pumping lots and lots of blood through now, like really going fast. Nitric oxide does that vasodilator. So all of those nutrients
Oh,
now can get out of the bloodstream and into where we need them. So that's why we have nitric oxide. We
so
also,
adrenaline, ATP, the
mhm,
glycogen. That's why you can lift a lot of weight if you can
yeah.
really focus and go. Gotcha.
And then, so in flow, it's, we want to stay in there. You got endorphins and anandamide and all of these. And anandamide is basically endogenous cannabis. So anandamide means the bliss.
Oh, okay. Like I've heard them as. Am I wrong on this? I've heard them as cannabinoids in your body, or is
Yeah,
that wrong?
cannabinoids. Yeah, it's
Okay.
anandamide is a cannabinoid. We
Okay.
discovered cannabinoid receptors because of marijuana, and so that's why we named them cannabinoid receptors. But they're in place for anandamide or 2-AG as well. And so when anandamide binds to a receptor, that's that kind of blissed out feeling that we have when we're engaged in a task that we love. So when you're benching and you're just like, oh man, this feels good, and you're
Yeah.
in the zone. That's anandamide. That's flow,
That's pretty cool,
right?
man.
So all and we talked about breathing stuff before. There's some breath work that I do that naturally gives you a massive hit of nitric oxide. It only takes about 20 seconds to get there. So that combined with just a small amount of THC creates an environment in which um, focus and movement and all those things are just a little bit easier to get into. And I realized that I'm not using cannabis like many people are using cannabis. When I say that, when I go, yeah, that's what I'm doing with it, and she's going, yeah, I don't think most people are doing that. I think they're getting a bucket of chips, a bucket of KFC, and just getting stoned.
Yeah, pretty much.
So I like that. I like anything that promotes more movement, and I don't like
Yeah.
things that make movement harder. So for me, a little bit of THC helps me move more. Too much THC makes me stop.
Yeah, it's going to make you sink into the couch.
Yeah. Um, which at 9 o'clock at night when I want to go to bed, kind of helpful. But at
Yeah.
9 a.m., really unhelpful.
Oh man, I can't even imagine. I got a friend that is basically just on it 24 hours a day, and I don't even know how he thinks, let alone gets up and goes to work.
Yeah,
But
I see the amount some other patients consume in a month, because in Australia it's very heavily regulated about how much a doctor can prescribe over the course of a month. And they tell me
mm.
how much I'm entitled to, and I go, gee, I don't even get through half of that in a month. Like, what are people doing? Like, other people are asking, can we get more prescriptions? I'm going, how are you consuming so much? Like, this is hard to do.
Their tolerance must be through the roof.
I think so. And I think, obviously having studied it in great detail, it's not that hard to keep tolerance down with something as simple as cannabis. It's just really about
So
being,
just kind of like
just be a little bit,
don't do it every day, or
don't take more than you need. It's only from taking
okay,
more than is needed that you get this cycle of tolerance.
okay,
Because if I need, say, 50 units to get the job done and I take 80, then I'm basically teaching the system that 80 is the new level that I need.
okay.
And so,
And because you can't overdose on it,
yeah,
it'll just keep bumping up.
yeah. So so essentially there's all this stuff, all these changes that happen at the level of the synapse and with receptors. So receptors get
Mhm.
trafficked around the synapse, and they increase their activity or decrease it, and so you just end up being that you need more to get the same effect. But if you don't do the overbinding in the initial phase, then you never build up tolerance. So just go, well, just don't take too much. And if you take too much,
Cool.
have a couple of days off afterwards. Let the system, like literally, let the system reset.
So it's different than CBD. THC is very different.
Well, THC will actually promote those what we call the psychoactive effects. So where you feel stoned.
Right, right.
Um,
Because CBD, you don't feel any of that.
yeah, CBD is mostly binding to a different receptor and has a different sort of cascade of events that happen after binding to that receptor. So
I
it's
see.
just it's mostly the things that bind to CB1 receptors that will make you feel high. Which, interestingly, is what people are experiencing when they talk about a runner's high. They're stoned.
Oh, okay.
Yeah, essentially.
I guess I'll never feel that because I never
I'm
ran one
never
day.
running. Yeah, so yeah, it's
I'd
basically.
have to go skydiving to feel that.
Oh man, I was just talking about skydiving yesterday. I love that. I loved skydiving. So much fun.
You went skydiving?
Yeah, skydiving, bungee jumping, lots of things.
You're
Anything where
braver than me, man.
I'd move downhill fast. I just like going with gravity. Gravity's really fun. Um, and then I'd finish doing that, and I'll go to the gym, and I'll play with gravity in the other direction. You know,
one way the Earth is going to kill you, the other way the bar is going to kill you.
right? Either way, I'm treating gravity as a toy.
Yeah.
Yeah. But yeah,
I don't know.
going
Did
back
we get?
to THC and CBD, I think they're very useful as long as you know what they can be used for, and they've got a very narrow usefulness. Like outside of what they're good at, they're really not helpful. Like the decreased coordination, decreased concentration, decreased motivation, all those kind of things. You go, well, they're not that helpful. So that's, like you say, really careful about monitoring effects and understanding what effect it's having on your body and whether that's the effect that you're after.
What about for like neuropathy, fibromyalgia, and stuff like that? Do you think it? I don't know. Does it work for stuff like that?
Fibromyalgia. Um,
Yeah, kind of like a widespread nerve pain type deal.
yeah, I don't know. I haven't seen any research on that. I'm sure it's been
Okay.
done. I'm sure it's been done, but some of that widespread pain, like CRPS and fibromyalgia, and it's just so tricky. And for me, it seems more to do with like this global threat response. That anytime you kind of
So it's
lower,
more like chemical.
I, it's complicated. Like there's so much going on with those ones that there's so many different. Our brain is perceiving so many threats from within the body that it's hard to tell what's causing the pain. But we just know that there's this feedback loop that's going on somewhere where the brain is perceiving most of what the person is doing as being quite threatening, and so we'll put out a pain signal to stop them doing the thing that the brain thinks is going to kill them.
Yeah.
But there's no kind of connection in there. We're going, well, that it's that they're doing that. It's way more complicated. It's like lots of things acting on lots of areas at the same time, and the combination of all those things produces this weird pain syndrome.
That's rough.
So in that regard, you go, yep, could be awesome, and it could do absolutely nothing, or it could make it worse.
Oof. Oh, that would suck.
Right? That's when you get to those extreme levels of pain, like fibromyalgia, like CRPS, the rules just don't seem to work anymore. And
it's kind of just find what works and stick with it.
Yeah. I think for those ones is finding other patients more often than not their doctors, and go and asking them, what do you do? How do you manage it? And just pick one that seems to work. Or that you like, because there might be ones that people do that go, this really worked for me, and you go, that's not in line with my values. I don't want to do that, or or I have a nasty reaction to that. Is there anything else? And so the more complex pain is, and the more chronic it is, I think the more bespoke we have to become with our interventions. That it has to really be a lot of trial and error to find what works for the individual.
Mm-hmm. Do we have any more?
Let me see. I think we've got one last question now. We've got two. We'll go to the last one, and then we'll do the question one first, which is about heat, because I went and prepared an answer in advance for this one. The question was, why does heat seem to work so well for many types of musculoskeletal related pain? The old way of dealing with anything that was inflamed, bruised, or was always ice, right? Which is rest, ice, compression, elevation. Can you describe what is happening here? And I will in a very neuroscience way in just a second, but I wanted to get your take on using heat versus ice, and whether you have any stories, tales, whatever it is.
Well, I mean, I can sum it up easy. Basically, heat is just going to send a lot more blood to the area, and it's going to bring more nutrients to the area and loosen up maybe muscle spasms and tight muscles, and that's going to make you feel better, especially make you able to get up and move around more and get through the rehab. That's kind of what works there in a roundabout, condensed way. I'm sure you'll be able to.
Yeah, that's like heat causes vasodilate, like the very biomechanical way. We get increased blood flow, like you said, and especially to Golgi tendon organ activation, which is really important in muscles for how tight a muscle will be. That starts the activation of that is why the muscles kind of relax and get out of spasm.
Perfect.
So if you put a heat pack on your tendon, you'll feel your muscle will relax.
Right.
Which is kind of fun.
Right. Yeah. You said it a lot better than I did. Now ice. Yeah. Ice can work.
Ice is an interesting one, isn't it?
Ice can work. It just depends on what is going on. Now, ice can work if you have more of a neuropathy type pain. If your pain is more nerve, it'll calm the nerves down. But if it's kind of if the nerve pain is causing your muscles to spasm, you're going to want to go ice and then heat right after.
Yeah.
So it's kind of like you're calming the nerves down, telling them to stop putting your muscles in spasm. And then you're going to tell the heat to stop the spasm, right? Because our bodies and brains are really smart and really stupid at the same time. Because it puts us in a cast, the spasm, to say, hey, don't move, you're hurt. We don't want to get any more hurt than we already are. But it's the spasm that's causing the most amount of pain.
Yes. So we need to need to deal with that as well.
Right. So you got to get out of the spasm. So you got to move. You got to kind of work. A term a lot of people like to use, including myself, is you got to burn the spasm out. You gotta send a ton of blood into that spasm in order to get it to loosen up and tell your brain, tell the nerve signals to say, hey, listen, we're not as hurt as you think. Loosen up so that I can keep moving.
Mm-hmm.
And at least that's how it's worked for me. That's how it's worked for a lot of people. And that's how it's worked in, at least in the text that I've read. So going back to the heat versus ice, the person that actually wrote the little thing, rice, R-I-C, R-I-C-E, rest, ice,
Compression,
compress,
elevation. Yep.
elevate. He even came out later on and said, I was wrong. It doesn't work.
Yeah.
So don't do that. It doesn't work.
Compression, elevation, and movement. And the modern one now, we're coming back to movement again. Like we said an hour ago, got to keep moving.
Yeah.
It's all about movement.
You have to move.
Got to be movement.
Now, I think compression works.
Yes.
Compression and movement works.
Absolutely.
I think ice can work with, again, like I said, during certain things. Like if you have arthritis, that can bring down the inflammation in the meantime, and then you throw some heat on top of it after that.
So for arthritis, it's heat if you want to get moving. Once you've been moving for too long and get pain, put ice, but then return to heat again.
Right.
Yeah.
Right. Exactly. I think ice works a lot better for nerve pain more than anything. If you have muscle spasms, keep the damn ice away from you. It's just going to make you even tighter.
Yep.
You want to vasodilate. You want to send a lot of blood in there. You want to heat up so that you can get up and move, and then get up and move. But I want you to keep going because you're going to explain it a little bit more sciencey.
There's a couple of fun things in there. There's these from the brainstem. There's these descending pathways that are inhibitory, that are activated by heat, and there's these really cool little. They're my favorite receptors. They're called TRPV1. I think it's a cool name for a receptor, but it is it's transient receptor potential vanilloid. And so scientists discovered that vanilla would bind to this certain receptor and have an effect. And so that's how it was discovered. The things that normally bind to TRPV1 receptors are capsaicin and anything spicy. So that's how we detect chili. They're also active with cannabis too. They respond really well to cannabinoids, and at low levels they respond very positively to heat. Right, so as long as you don't get too hot and have that cascade where you experience like the burn from chili, if it's just a little mild heat, it's like it sets off this chain reaction that becomes anti-inflammatory. It decreases the sensitivity of nociceptors, which are the pain receptors. And so there's less pain output just because you're kind of quietening the receptors and convincing them, hey, you don't have to send as many messages now. Just, we get you, you're there. And so they're the TRPV1 receptors, and then there's the descending inhibitory pathways that are all heat activated. And they're quite primitive. And when we say primitive, I mean in that animals have had those pathways in their bodies, in their spinal cords for a really long time. So we have it, reptiles have it, other animals have these things available to them, and they're all heat activated, which is, for me, that's really, really, really kind of cool that we have these, and it involves the periaqueductal gray area of the brainstem, which is really important for pain modulation. So we have a natural inbuilt pain modulation system in our brainstem and spinal cord.
And we have a way to regulate it through heat.
Yeah. So
that's interesting.
Interestingly, heat normally in most animals is either being out in the sun or being out in the sun moving. That's how animals tend to be heat activated.
And that's kind of why I guess people feel better when they're out in the sun.
One of many reasons why people feel better for sunlight.
Yeah.
So
that's interesting because it kind of contradicts what I was saying about the ice calming down the nerves. But it's almost like, to put it in a different way, like fighting fire with fire. Like a nerve is like firing off, and you're adding heat to say, hey, calm down a little bit? Is it almost like, tell me if I'm wrong, is it almost like, um, let me get the right words here, like loosening up the nerve sheath so that the nerve can almost send signals better?
It's less
Or,
mechanical than that. So
okay,
that's a very mechanical, especially biomechanical way to
so
think about it.
more
It is
chemical.
about, yeah, it's a neurochemical response.
Okay.
But it will change membrane permeability, and it'll, has downstream effects like that. But it is from literally activating temperature or thermoreceptors in the skin.
And and does it have to be the whole body's temperature, or does the heat, can it be anywhere on the body?
Localized heat, this one is. So, because we have receptors in the skin that detect temperature changes. And so as
Okay. So
long,
it doesn't have to be like on the brain stem.
nah,
It could be anywhere.
yeah, because we can't actually get inside the neck and put an ice pack on your brain. So just
No, no.
yeah,
I figured like, if you
yeah,
got it close or something
yeah,
like that.
yeah. So all the receptors for
So
this
that's
are in the
probably
skin.
why like that's probably why like the steam rooms
Yes,
work really well,
yep.
because now it's the whole body
Have
kind
you
of
have you
being
ever noticed
encompassed.
how much better you feel in summer on a sunny day if you're in pain to just walk
Yeah.
outside in the sun?
Yeah, 100%. Yeah,
Yeah.
way better. Way better in the summer than I do in the winter.
So that's what's going on.
That's cool.
Mm.
Okay, so scratch what I said. Don't use ice.
I still use ice is still helpful for some things at some times. It's
Yeah,
just that comes back to
I'll
that
still use.
depends the thing, right?
Yeah, I think everything we said, it said it depends and keep moving.
Keep moving.
That was basically the answer to every question.
Really does, doesn't it? Let's see. We've got two questions here. I read them both because they're kind of the same. How do I stay motivated? I'm all in for a few weeks and then I just stop. Am I doing too much? Putting too much stress on myself? And the other one was I was very active before my back surgery. I've been, and air quotes, cleared to resume my former activities. I'm afraid to get back to where I was, so I don't do anything. It's been months. What now? I think they to me they sound kind of like the same question because we're talking about motivation in both of them, and one's an example of doing too much, and one's not enough. But I think at its core is the motivation to approach something that is quite scary, um, and is going to take a long time to have the effect that we're looking for. So, how do you stay motivated? And how do you stay motivated enough to not do too much?
You want to go first? Or you want me to go?
Let's. What do you got to say about this one? It's a tricky one. Like it's just
The motivation is fake. It doesn't work. It's not real. It's
yeah,
fleeting.
right.
That's what I think. Motivation is something that people made up to sell things. That's honestly what I think.
I think
Um,
the very neurosciencey definition of motivation is just what's the stimulus to ignite a behavior. And
right.
so I think the way we talk about motivation in the general sphere is as if it's some kind of magical thing that you get from outside and go, it's not. It's all internal. It needs to be internal. It
Yeah.
has to come from within because that external motivation, or I always say inspiration, external motivation is inspiration. And that is
Mm-hmm.
incredibly fleeting and disappears. And if that's how
Yeah.
you get up for anything, you're going to need to watch a lot of David Goggins.
Yeah. It's gonna have to be on repeat all the time,
just
and then
David
you're gonna
Goggins,
realize that he's just trying to sell things.
right? Just yelling, "Who's going to carry the boats? You don't know
Yeah.
me, son." Okay, well, I'm not carrying the
I've been
boats for
running
you
with
then.
my broken feet. So
Oh, actually, while
I
we're on
don't
that,
think
don't do anything David Goggins does to deal with pain. David
no.
Goggins is the example of what not to do when managing chronic pain conditions. Just don't.
Right. Right. He's like, I got shin splints. You know what I did? Hit my shins with a hammer. It's like don't listen to him. Don't listen to him.
Yeah,
That dude is a
if you
nutcase.
think you're experiencing rhabdomyolysis, go to the emergency department. Don't keep running.
Immediately.
Don't keep going.
No.
Don't push through. Dear me, David Bloody Goggins. All right. So back to that. So motivation or staying on
Okay.
track with it for a really, really long time. How do you do that?
It's definitely more about consistency, more about being driven than it is about motivation. So,
That's an interesting distinction you make there between drive and motivation. Because in science we use those two terms synonymously. So how about for the next time?
yeah,
Let's talk about I will hear motivation every time you hear drive. But I think that's if we call it drive, this internal drive to do something.
yeah, I definitely don't think drive is the same as motivation at all.
Okay.
It's
Well, let's talk about
because
drive then.
I am I am a very driven individual,
Oh,
and
yes, you are. Yep.
if I want something, there's nothing on this planet that's going to stop me from getting it.
Yeah.
That's the difference between motivation and being driven,
Okay.
because it took me 20 years to get to the Arnold. Motivation is not going to do that.
Okay. I like that difference you make there. So you kind of think motivation is more short term, comes and goes, but
Yeah.
drive is that deep. This is part of me.
Yeah.
If I don't go after this, I'm denying my humanity, and all those kind of things.
It's passion,
Right.
passion in its purest sense.
Yeah, 100%
You
with you.
want something bad enough, you're going to do everything and anything for how as long as it takes to get it.
Yeah.
You're going to do the things that you don't want to do in order to get it. Now, motivation, if you want to use it, it's good. It'll get you up off the couch. But staying consistent for weeks, months, years, and what we're talking about this whole podcast, decades, your entire life to stay in shape, motivation ain't going to cut it. You have to be consistent. You have to be driven. You have to do the things day in and day out that you do not want to do sometimes.
Yep.
Because every day, sometimes we don't want to get up out of bed, but we get up, we brush our teeth, and we kick everybody out of the way that we need to do, and we get everything done. So that's kind of what you do, right? So that's kind of like my short little answer, and that's probably gonna quote unquote motivate you, but hopefully it drives you to stay driven and consistent.
Yeah. So for me,
you just gotta kind of put one foot in front of the other. I hate to use these stupid things, but you have to put one foot in front of the other.
They're so true though.
And if you're talking about exercise, it's got to be find something you love to do, find something that's fun.
Yep.
That'll keep you interested. And if you haven't found something, keep trying new things. Whatever makes your heart rate go up and whatever makes you do things, do that. If it's about food, right? Because food is a big part of it. Mm-hmm. And a lot of people hate eating the same thing every day. I don't care about that. I will eat the same meal every day for the rest of my life. I'm just weird like that. But I know 99% of the people aren't. Keep trying different meals. There are apps. We live in a very technologically advanced world now. It's not like it used to be when I started.
Yeah, true.
You can literally take pictures of food and it'll tell you how many calories in it now.
I know, right? That blows my mind.
It's like there's no excuses now. There's none.
Do you still remember all your macros though from when we had to remember, early 2000s? You just got sheets in your head, and you know that there's this many grams of protein in this size egg, and this one has this much fat. And,
At one point, I was eating over 6,000 calories to get as big as I was.
Dude, I was one. That's what I was eating. Was around about 6,000. I was 175 kilos.
I was only 105. I wasn't supposed to be that big.
That impresses me that you could eat that much.
Dude, I was plowing food. I was eating 7 meals a day.
Oh,
I was gagging when I was eating.
I just used to.
That's the difference between driven.
I cheated so much with my nutrition to get the calories in.
Eat crap food.
Well, a lot of steak, a lot of vegetables, but in order to get enough calories to recover from training, it was like pie and ice cream were permanently on the menu every night of the week.
It's easy to get those calories,
ice
man.
cream, milk, cream cheese, peanut butter, all into a blender. Ooh, it's good.
Oh my
So, tastes
god,
amazing, but it's just a whole lot of fat and sugar.
that
It
sounds so crazy.
right. It tasted really good. I like the way it tastes, and it's not a chicken shake. That's for sure.
You
Like
know,
I'm not making chicken shakes. I will go to my grave going, I'm never drinking one of those wretched things. They just even the way
he
he described it, like the way he first described it when he said, "This is what I'm doing." We're like, man, that's disgusting, absolutely disgusting. And then he put,
he's definitely not the first person to do it.
and then he put the. We're talking about Blaine Sumner here. If people didn't
Yeah,
pick this up, then he makes this video and tells people this is what I do, and he put it on YouTube. I just remember we gave him a real hard time about it. It's not worth it, dude. It's just not worth it. But for Blaine, I figure if we ask him now, was all those chicken shakes worth squatting 500 kilos? And he'd go, yep, absolutely.
mm-hmm.
That's the discipline. That's the drive that got him there. He was driven enough to make chicken shakes. Oh, it makes me vomit thinking about it. That was beyond where I
Got to
was
do
willing
it,
to go.
man.
I just wasn't willing to go there.
And you know what? And there's nothing wrong with that.
No,
It's just
not at all.
I think
It's probably why
like
he had. It's one of the many reasons that and genetics why Blaine had such better results than me. He was so much stronger than me. He was just willing to do things that other people weren't willing to do.
mm, yeah,
And I think that comes
and
back
that's
to that idea of drive, doesn't it? That if something is important enough,
yeah,
if it's deep within your soul and it's really important to you, like you just said, you'll move heaven and earth to get there. And it won't matter what pops
yeah,
up. You're going to turn up. You're going to train on Christmas Day. You're going to get your cardio in on days that you don't want to. You're going to do the things that you hate because there's something there that is so important to you as an individual. And I say it has to be at the level of your identity, that is part of who you are. And if you don't do this thing, you're denying yourself. That's drive.
yeah.
That's not
And
motivation
you're
anymore,
gonna
is it?
regret it.
Yeah.
Yeah, you're gonna regret it one way or another down the
Yeah.
line that you didn't even try. At least try.
You know, a few weeks back, I had Parry, that parabencher from Sydney, on the podcast, and I love the way he puts it. He said literally that. He goes, "I've just tried heaps of stuff. Like he's had so much, like gotten over so many different medical things, and now he's going to world championships. I love parabench because they strap you onto the bench. You know, lie down, and we're gonna Velcro you in. You're going nowhere. So he's going to Egypt to do that, and he literally going, yeah, there's a lot of stuff that I've failed, so many things, but I just have another go. Wake up tomorrow, try something else. I love that.
Yeah,
I think that's the secret
yeah.
sauce, isn't it? Just keep going, try again.
What else is there?
I think that's where we get to, isn't it? Like, well, yeah, stop trying, sit on the couch, do nothing. And I want to make sure, like, I want to
Time.
be really honest about this. There's days and weeks where I sat on the couch and did nothing. Like that's still there. There's still that response in people. But as long as when you get to that point, you go, all right, get up and do it again. Try something else. Just go again. It's okay. As long as you haven't completely
That's it.
stopped. As long as you get up one more time. That's all. That's all I think life is. Just go one more time.
I mean, what? That's it. Like full stop. I'm not going to add to that. Like, you know, I do. You know what? I do want to circle back to the what was it? She had he or she. It doesn't matter. Had back surgery.
Yeah. And now they're just kind of scared of, I think the fear is of doing too much and re-injuring.
If you're fully cleared, it's basically it's all mental.
Yeah.
And
I was going back to that cleared thing. If I've worked out now, if a doctor says it's okay, it's really, really okay. Because there's a lot of things doctors will tell you not to do, even though you're getting
right,
really great results from it. So
right,
if a doctor says, yep, you're good to go, it means number one, you are really good to go. And number two, I'm so confident that I'm not concerned about my medical liability insurance.
Exactly.
Because that's the number
Like,
one thing that the doctor's concerned about is this going to affect me and my family? If I give you this advice and it goes wrong, do I stop being able to provide for my family? So that medical liability insurance is really important. So you don't want to do anything
yep.
that would undermine it. So if a doctor's saying, hey, this isn't going to affect my medical liability, then you really are good to go.
Yeah. You're not going to hurt yourself any more than you did before.
Yeah.
Like that part that you hurt, that's it. It's fixed.
It's done now.
It's better.
Yeah.
Now you just have to build up, like we've been saying this whole podcast, you have to build the strength in those areas. You have to just build up.
Mhm.
And if it takes you a long time, so what? Time is going to go by anyway.
Yeah.
So just take your time, start from wherever you got to start, even if that means just getting up and down off the couch. Stand up, sit back down, stand up, sit back down, and do that 10 times, do that 5 times, do it 3 times, whatever it is, and then progress from there.
Yeah.
And don't think about what you did used to do.
Oh, that's hard, isn't it?
Think about what you're what's that?
That's hard to do. To switch
Yes.
switch off your memory. Yeah.
Right. But if you look at it as this is a new body and every day I'm going to hit a PR and a personal record.
This is true.
And that's going to actually help your brain kind of like with, all the chemicals in your brain, and you're going to make you happy, and you're going to go, hey, I did 5 squats today. I did 5 body weight squats, or I picked up, a 5-pound plate off the ground.
Mhm.
Stop worrying about how you used to pick up 25 pounds. This is a new body. You're picking up 5 pounds.
Be here
and
now.
then
Be
the next
present,
week
right?
you did it for 3 reps, and then 5 reps, and then 10 reps. You're breaking records every single time that you go into the gym or in your house or wherever you're doing it. And it's going to make you more and more, quote unquote, motivated to keep going and keep at it until you eventually break so many PRs that you're not just where you were before the injury, but past where you were.
Yeah.
So you can be better than you were before the injury. Potentially. I've seen so many people have catastrophic injuries come back and be better than they were. So there's nothing saying that this person can't. I don't care how young or how old they are, what their injury was. You got to stop putting limits on themselves and just go after it.
Yeah, that's the big one. Is just get after it. Find out. Just go find out.
Right.
Hey,
find out. Find the damn answer.
Worst thing happens is you find out that you're right and it didn't work. Cool. Try something else. Best case scenario.
And you're further along than you were anyway.
Right. You've tried something. You've built a little bit of resistance. You've developed the skill of persevering. You've developed the skill of going again. And you're one step closer to finding the thing that will work. Because, if you stop looking, you're never going to find it. Louis Simmons, like when he first started writing articles back in the 2000s, talked about there being a car park with 1 million rocks, and under one of the rocks is $1 million. I'm like, all right, I'm picking up every damn rock until I find the $1 million. And that was his point. He goes, you would pick up the first one. More than likely, you're not going to find $1 million under it. Are you going to pick up another rock? Or are you going to go, oh, damn, I didn't get it? You're going to keep on picking up rocks until you find the $1 million. And so that for me is this whole thing with find something that works. You're going to find it eventually. The only way you won't find it is you stop turning over rocks. Just keep going. Just one more time.
And there's always going to be more rocks.
Right? It's like we're growing rocks every day. There's a factory. But there's always answers. There's always a solution. It may not be the one that you thought you were looking for, but there's a way.
Yeah, ain't that the truth? Yeah.
Oh man, we got through the questions.
I became a philosopher.
I think we've done some good for people in pain. I hope we haven't.
Yeah, this was good, man.
But I think that the big thing for me is recognizing how isolating pain can be, and offering ourselves as a connection point for people in pain if you're reaching out to find out ways or to work with people who've experienced the pain and taking some ownership, I think is really important. And I think that's the big first step in dealing with pain, is finding somebody, finding other people around you that can journey with you through that pain experience. Because doing it solo really sucks, doesn't it?
Yeah, for sure. Um, it's not fun.
Yeah. It's
I
not.
mean,
It's just not. But I think it is definitely one of those things can be mitigated with good people around you.
yeah, knowledgeable people.
Yeah,
You get
knowledgeable,
and you have to be
empathetic.
an advocate for yourself too. So don't rely on other people either. Learn.
I think that's the real. I think that's huge. The amount of times I've heard people saying that, "Didn't you realize I was in pain?" And I'm thinking, "No, didn't notice." And I know people didn't know that I was in pain most of the time, and I wasn't aware of how much pain you were in the times that I've spent with you. Um, Pain is really
You
personal
be,
and it's very private. It's very private. So, making space for people to talk about pain, to deal with pain in a really non-judgmental way, that's something that I'd love to see. Because pain doesn't mean you've done something wrong. It's not a
right.
judgment. It's just
You
an
be
action
you
signal to move different.
you become good at putting on a mask
Mm.
when you're in pain all the time, and well, you don't look like you're in pain. Yeah,
You-
well, if I outwardly showed you how much pain I was in, it would look like this. Ah!
right?
Just screaming all the time.
If I
And
acted on some of the thoughts in my head in response to the pain, I would have punched you in the face by now.
yeah,
That kind
yeah.
of
Like,
stuff.
I don't like what you're saying. I want to choke you to death. So, yeah, yeah,
You should go.
pretty
I
much.
don't.
Yeah, my whole day is violent thoughts. I'm depressed. I want to shoot myself in the head. Violent thoughts. I'm kind of hungry. Violent thoughts.
Right.
It's kind of these weird waves. I don't know, man. I don't know what to even say anymore. It's just one of those things. But I think we definitely answered a lot of good questions. We answered them very thoroughly, and hopefully everybody got really good answers and at least a way to you know get get started and get moving.
Yeah, I agree. I hope somebody listens to this and they go, oh, there's a few things there I can try and hopefully makes it better for them. My ask for people listening then is, if you know somebody that deals with chronic pain, or if you know someone that's going through a long rehab, um, get them to listen to this podcast. Tell them to reach out either to Jack or myself, and we're here to help. Like, seeing people get out of pain is really quite rewarding. So yeah, get in touch. And for you, Jack, thank you for everything. Thank you for your expertise, your willingness to share, and I'm pretty certain people will be able to identify with a lot of what you've said here today.
Yeah, thank you, man. Thanks for having me.
All right,
It was
man.
great.
Cool. We'll do it again soon. That was good.